Walk in My Shoes spotlights the invisible struggles of people living with multiple sclerosis, MS, a public health awareness initiative by Roche in collaboration with Multiple Sclerosis Society of India, MSSI, Bangalore, August 22nd, 2025. Millions globally and approximately 2 lakh people in India live with a life-limiting neurological condition called multiple sclerosis, MS. The disease affects their central nervous system, depriving them of their ability to perform simple everyday tasks like walking, cooking, bathing, or the strength to hold a child. Their day-to-day struggle remains hidden, and performing everyday tasks can feel like scaling an invisible mountain. One can't see and feel the burden MS patients carry. To bring a spotlight on MS, Roche Pharma India, in collaboration with the Multiple Sclerosis Society of India, MSSI, presents Walk in My Shoes, a public health awareness initiative to highlight the often invisible struggles of individuals living with this life-limiting.
Something as simple as holding a spoon, something as simple as walking across. I was sitting with the gentleman here who is also the representative of MSSI here in Bangalore, who himself is a patient. Some things that we consider normal in life are considered a little. It was really heartening to see the way how they encounter the challenges, what we think are normal. Something as simple as getting access to an ATM. We want to create that awareness. We are indeed very privileged to have been associated with MSSI here with this. It's a privilege here to have Arun Kumar sir here with us. We want the general public to be aware about what challenges these people face through. We might be having pioneering technologies from Roche side, but how we can create that awareness is what the endeavor is here. You will see a certain set of challenges that are here that we want you to experience. Something as simple as walking on this with so-called weight strapped to you, or if you have something like a vibrator strapped to your hand, how can you write? These are the symptoms that are there, that is people are facing day in and day out. Thank you for the time. Please spread this message. Please create awareness. Thanks. Back to you, Siri.
Everybody, and thanks for being present out here. Sorry. I've been living with, I was telling these guys about it. You asked me when was I diagnosed with MS? I've been living with MS for the last, officially, for 15 years. Okay, the unofficial part is that I've been living with it for the last 30 years. So, the moment you say, how can I live with this hair? It's there. So you can't do anything about it, so you live happily with that. Now, like what Sir said, I'm sure the moment you have a vibrator or, you're made to walk in one of these stages, you know what difficulty a person with MS goes every day. I'm not joking about it. It's very, I felt very, embarrassed when, when we came down here and we actually had to have 3 people lifting my wheelchair to make me sit here. So it's kind of, it's an embarrassing situation where, you can do it, but you can't do it. So, and half the people do not understand what I'm going through. I'll be honest to you, okay. I have something called as nystagmus. Nystagmus is one of the first symptoms that you have when you're diagnosed with MS. Now, in nystagmus, what happens is that your eyeball is going right and left. Okay, one part of it. The other part is that I have something called tremors, where my head is going up and down. So, my eyesight is going right and left, my head is going up and down, and what for what I see right now is everybody going in circles. So this is something that is very, very difficult for people, normal people to understand that, when I say for me everything is going in circles, they're like, we are all standing here, we are, normal people. What I see is everybody going in circles. I've been wearing my glasses from, third standard. And I started with something, the power that I had was -3. And that time, I never knew my power is going to be so high. Okay, very good afternoon to everybody. My name is Arun, and I'm a life wellness coach. And I've been living with multiple sclerosis, what we are here for the last 15 years. Now, like I've been telling everybody, there are two versions of it. One is the official and one is the unofficial. The official part is that 15 years back I was diagnosed with multiple sclerosis. Unofficial part is that I've been living with MS for the last 30 years. Now when I say 30 years, my first symptom was something called as nystagmus, where my eye goes right and left. Now, unfortunately or fortunately, what also happens is one of the symptoms of MS is tremors. So I had tremors in my head. So my head goes up and down. Now today, believe me, when I see everybody, there is so many mics here and there are so many people standing out here. For me, all of you are going in circles. So I don't know which part of, where you're actually standing for me to look at you and, talk to you about my, multiple sclerosis. Today, I'm part of the Multiple Sclerosis Society of India, and we have around about 3,000 people who are registered members with MS in India. But with a population of 140 crore people in India, estimated number of people who have MS is around about 4 lakhs. Now, when I say 4 lakh people, officially they say is 4 lakh. Now, this data that we have is more in the Tier 1 cities. The Tier 2 and Tier 3, they don't even know what MS is all about. There's very lack of awareness which is there for these people to understand what MS is all about. Now, look at it like this. You are diagnosed at the age of 30 or 25 or 30. That's when your life starts. Your adulthood starts, where you start working and where you plan to get married and where you plan to start a family. Now, what happens in this is that one, finding the number of neurologists in a Tier 2 or Tier 3 cities are very limited. Two is that once you're diagnosed also, to confirm your diagnosis that you have MS, you have to take an MRI. Now, MRI on an average costs around about 20 to 25,000 rupees. So the person in the Tier 2, Tier 3 cities leaves it away. Even if he takes an MRI and he is confirmed with MS, the medication cost is so high. Just to be honest, I take 2 injections which cost me 1,60,000 every year. Now imagine if you are spending 1,60,000 on medication, and this is not a cure. It is just making sure that you are stable, nothing else. Now the awareness right now is so low about multiple sclerosis that people don't talk about multiple sclerosis because of the social. One of the reason is that the social stigma which is created, where they say, the person needs to start a career or they get married and everything goes for a toss. So this is something that about MS. One of the things that I request, I wanted to request through everybody is that, one, we need to create more awareness Two is, we've been speaking with IRDA for the insurance part of it. We are not, MS is not covered by insurance. So it is a strong belief that, if people having MS can get an insurance to help them, it will make a lot of difference to these people, and make sure that, lot more people will come out and say that, there is something called as MS that I have and I live with it. One point that I would like to make is that we are person with disability. We do not want sympathy. We want is empathy. And I'm sure, with a program like what Rosh is doing right now, where, walk in my shoes, we can create a lot of effort in the society in general about MS, and people with MS are not looked down by anybody, saying that, you are a person with disability, so you have to live with it. Today, we also are talking to, lot of organizations, because the employment becomes next to zero. There's a lot of requirement of, affordable accommodations which need to be done, and not many people are willing to understand that MS, in spite of MS, you can live the way you want to live your life. And I'm thankful to everybody to give me this opportunity. Thank you so much.
Thank you so much.
Good day.